Hey everyone, welcome back. Today, we're diving into a serious issue that could impact how millions of Americans access healthcare, especially if you or someone you love relies on Medicare. The federal government is taking a bold step by going after some of the biggest names in health insurance like Aetna, Humana, and Elevance. These companies, along with major insurance brokerages, are being accused of giving illegal kickbacks and using discriminatory tactics while pushing Medicare Advantage plans. And this isn't just about corporate corruption. It's about how real people, especially seniors and those with disabilities, may have been misled during one of the most important decisions of their lives: choosing healthcare coverage. If you've ever felt overwhelmed or confused while enrolling in Medicare, or if you've suspected that something didn't feel quite right, this may help explain why. Stick with me. This could make a big difference the next time you or your loved one needs to choose a plan. So, what exactly is going on here? According to a federal lawsuit filed in Massachusetts, 3 major insurance companies and 3 well-known brokerages allegedly operated a scheme that wasted billions of taxpayer dollars over 5 years. The government claims these companies use shady payments, disguised as marketing partnerships or development funds, to secretly influence brokers. Their goal? To steer seniors into specific Medicare Advantage plans that earn the companies more money, even if the plans weren't the best fit for the patients. Let's break it down simply. Traditional Medicare is run by the government. You can go to almost any doctor and Medicare pays that doctor directly for each visit or procedure. Medicare Advantage, on the other hand, is run by private insurance companies. The government pays these companies a fixed amount every month for each person they cover. More if the person is in poor health. Sounds reasonable, right? But here's the catch. If the companies are paid more for covering healthier people, they might have a financial reason to avoid enrolling sicker or disabled individuals. And that's where the trouble begins. The Department of Justice says that from 2016 to 2021, insurers were paying brokers under the table to push specific plans. These weren't just innocent bonuses. The DOJ says they were structured to push people toward plans that helped the company's profits, not plans that served the patient best. It gets worse. Some brokers reportedly made it harder to sign up for other plans by hiding or removing links, changing website layouts, or even redirecting phone calls based on your age or health status. In other words, the choices you thought you were seeing online weren't the full picture. And if you called for help, your questions might have been filtered to protect a company's interests, not your health. This isn't just unethical, it could be illegal. When people look for help choosing a health plan, they trust that the advice they're getting is honest and in their best interest. But according to this lawsuit, vulnerable patients, especially those with disabilities, were often pushed into plans that didn't include their doctors, didn't cover their medications, and left them with higher costs. Now, here's another disturbing layer. The government says these companies actively try to avoid signing up people under 65 who qualify for Medicare due to disability. Why? Because these individuals are considered more expensive to cover. Internal emails in the lawsuit show brokers were even praised for lowering the number of younger disabled enrollees. Think about that. People who already face enormous challenges in life were being intentionally excluded, not by accident, but by design. Through shady website tricks and broker manipulation, they were quietly pushed aside. And who paid for all this? You did. These are taxpayer dollars, our money, that funded this system. Some might argue, aren't brokers always paid? Isn't this just marketing? Sure, brokers can earn commissions and companies promote their plans, but the law clearly says you can't make payments that influence medical decisions in a deceptive way, especially when it involves vulnerable people. That's why the government is using the False Claims Act, an old law created to protect public funds from fraud. It even allows whistleblowers to report wrongdoing on behalf of the government. That's what happened here. Someone inside the system saw what was happening, came forward, and now the Department of Justice is involved. So what does this mean for you? If you're currently on Medicare Advantage or thinking of enrolling, this is your sign to slow down, ask questions, and make sure you're seeing all the options. Ask yourself, am I being pressured? Is this advice truly unbiased? Is someone making money off my decision? And if you're helping a loved one, a parent, spouse, or friend, this is a reminder to be extra careful. Not all help is helpful. The good news is this lawsuit could lead to real change. Lawmakers are now pushing for more transparency, better rules for online Medicare systems, and tighter regulations on how brokers are paid. This might finally force insurance companies to focus on care, not just profit. Let me also take a moment to speak to those of you in the middle of this. Many of you have written in saying Medicare Advantage has worked for you, and yes, it can be great. It offers dental, vision, and sometimes lower costs. But when companies manipulate the system, when they take away your ability to make an informed choice, that's not okay. There's even a heartbreaking story in the complaint. One woman trusted a broker only to be placed in a plan that didn't include her doctor. She had to travel 2 hours just to get basic care. 2 hours, while sick, just because a website or a call center didn't tell her the whole truth. That's not just a broken system. That's broken trust. What happens next? If the government wins this case, these companies could be forced to repay up to 3 times what they took, plus other penalties. But even more important than the money is the message. Patients are not just numbers. They are people, and they deserve to be treated with respect and care. This case might even spark a national conversation about whether Medicare Advantage needs major reform. Is the system serving the people or the companies? I'd love to hear your thoughts. Have you had a strange or frustrating experience during Medicare enrollment? Did you feel pressured or confused? Share your story in the comments. Your voice could help someone else make a better decision. If this helped you understand what's really going on, make sure to subscribe. I'll be covering more updates as this case unfolds, and other important stories that affect you and your family. Because this isn't just a story about healthcare, it's about fairness, about trust, and about the kind of system we want for ourselves and the people we love. Thanks for being here. I'll see you in the next one.